Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of September 29th, 2022. This week, I'm going to talk about a question, which is what should I know about overpopulation? Now, some of you, if you watched last week's update on the global food crisis, know that at one point I talked about one of the issues contributing to the global food crisis was overpopulation. Well, it turns out that term is somewhat debatable. Some people say that there is not overpopulation, there's enough food to go around, we're just not distributing it accurately. Others say, no, we've got too many people. So let's take a look at the facts. All right, right now, the world's population is almost 8 billion. For those of you paying attention, we passed 7 billion in October 2011. And the world's population, as you can see, stayed pretty low for a long period of time. And then about 100 to 200 years ago, started shooting up. The way I like to remember it is since my grandfather was born, the world's population has increased almost fivefold. That means 5 times as many people on the earth today as there were 4 generations ago. Since my father was born, right before the Great Depression, the world's population has almost quadrupled. And in my lifetime, the world's population has more than doubled. So think about that, twice as many people on the earth today as when I was born. In fact, about 200,000 people are added every day. To put that in the context, that means the entire population of the state of Tennessee is added to the world every 5 weeks, week after week, 10 times a year. Think about that. The entire population of Tennessee is added to the world's population 10 times every year. And so what we've seen early on, it took a long time to add 1 billion people. The second billion took 124 years. The third billion took 33 years. And then since then, we've been adding billions of people about every 12 years. Now, think about this. As people are added, by definition, they're babies, right? That's the only way we know to add people to the world's population. So that means that all of these people that have been added since I was born, at least were for 10 or 15 years, entirely dependent on other people for food, for education, for jobs, for safety, all of those things. And if we look at where babies are being born, the growth rate is highest in sub-Saharan Africa. And so by definition, that's where people are most dependent, right? And so if you look at the distribution by age, you can see, for example, a country like Tanzania has a huge number of 0 to 4, 5 to 9, 10 to 14, 15, young people, whereas Peru is fairly stable. Countries like Norway, which are more developed, are less younger people, more older people. The problem, of course, is these babies are being born in the areas of the world that are the greatest, most impacted by climate change, sub-Saharan Africa and so on. And people say, well, gee whiz, why don't they just stop having babies? Well, there is something called the demographic transition. And it's a sort of a 4-step or maybe 5-step process. All right. So everywhere in the world, when they had high death rates, high mortality, infant mortality, adult mortality, there were high birth rates. There needed to be a lot of babies to replace the people that were lost. Then in time, as mortality starts to lower, birth rate remains high. I remember in school, we learned that there was about a 40-year lag between when the infant mortality rate dropped and the birth rate started to drop. And that's part 3. You see low mortality and then finally falling birth rates. And then ultimately, we're in a case like Norway, low mortality, low birth rate. It's possible that we may see a low mortality and a rising birth rate later on, but that gives you the sense that just because deaths go down, we don't see births slow down right away. It takes at least a generation, perhaps a generation or 2, before we see the rates start to drop. So, does overpopulation exist? Well, it's pretty hard for me to say that it doesn't, because frankly, as we learned last week, there are almost 1 million people at imminent death of starvation. Right? Even if there's enough food to go around, they are about to die of starvation. And then, of course, we have the increased concentration of people in big cities. These are the cities with 1 million, but there are cities now with 10, 20 million people. And you have to think about it. They have no ability to produce their own food. So they're entirely susceptible to fuel costs, fertilizer costs, transportation costs, the cost of food. And of course, it's not just food that causes problems from overpopulation, lack of economic opportunity, lack of educational, social, creative opportunities, lack of water, lack of fuel for cooking. There are a lot of things that happen when we have too many people. And then, of course, then the more people there are, the more susceptible they are to political unrest. So does overpopulation exist? Yes. Is there enough food to go around? In theory, yes, right? If we could focus food production on what we need to feed people and not on cash crops, if we could focus food production on what we need to eat and not just feeding animals, and if we could figure out a way of distributing food to people who need it in a way that they can afford it and that they can prepare it and preserve it, yes, in theory, there is enough food. In practice, the answer is no. So what should I know about overpopulation? It is a problem. It doesn't have to be a problem, but it is. As the world's population continues to grow, we're challenged to think about how we can make sure that all of those babies, all of those toddlers, all of those children, all of those young adults have the ability to live a meaningful, productive, safe, and healthy life. Is it possible? Yes. Is it happening now? No. And unfortunately, the parts of the world that are most impacted by climate change are also the ones where we're seeing the greatest population growth. So overpopulation is an issue. It's a problem. It's something we all have to think about. It's something we have to pay attention to. And hopefully I'll keep you updated on this as time goes on. There's a great deal more information about public health issues on the website. Please, 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 if you know anyone who'd like to watch these videos, go ahead and share them. Not only am I happy to have the information get out, but also because it gives me questions and feedback and lets me know what people are interested in hearing about. I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And please, if you have any thoughts, questions, comments, if I've said something you disagree with, or if you'd like to see me cover an issue, you want me to go back to COVID, monkeypox, gun violence, food safety, and so on, just let me know. I look forward to hearing from you. Until next week, please be well.